Today we're going to talk about the impact of pharmacy on mental health in our country's prison systems, as discussed by Brittney Duewell and Mary Thompson. Mental health affects over 45% of people and can range from anxiety to schizophrenia. Treating mental health has transitioned between facilities throughout the centuries. After deinstitutionalization during the Reagan era, prisons became the primary place for treating mental health illnesses. This is a problem because people with mental illnesses in prisons are not getting the help they need. Reform is crucial to establish ways to correct and reverse mental health crises taking place in our prison systems today. One way the mental health crisis among prisoners can be fixed is to tackle the problem within prisons themselves. One solution is to incorporate and establish a mental health screening test, which has many benefits to it. To begin with, many people with mental illnesses do not want to admit it due to the negative stigma that is foreseen with it. This is especially so in prisons, where the weak are usually targeted and picked on. However, if prisoners are screened upon incarceration, they would receive treatment for that illness without any of the other prisoners even knowing. Therefore, these prisoners can get better and not have to worry about the negative consequences that may come along with a mental disorder. Outside of prisons, other programs need to be set in place to help these former prisoners as well. Transition houses and services created between non-for-profit groups and collaborative efforts of mental health resources can directly target the issue. If these services can provide support and cheaper medications to those who are struggling to settle down and find a job, it would immensely help their situation. With access to medications and support, former prisoners can focus on finding and holding a job, setting up a solid place to live, and making a better life for themselves. Not only can these programs help former prisoners directly, but they can also be there to provide support and education to the families of the prisoners and the affected prisoners themselves. Knowing what is going on is a large part in being able to treat a disease and learning how to live with it every day. With the passing of the Affordable Care Act, Medicaid will expand and cover the cost for treating prisoners. Another large way to help inmates with mental health issues is to increase the role of a pharmacist inside the prison itself.
Mental health screenings and implementing transitional services are the first step with improving mental health in prisons. Increasing the role of the pharmacist in prisons is next. Pharmacists play a vital role in improving the quality of life for patients and are currently being utilized on an interdisciplinary team for treating and educating inmates about their medications. Responsibilities include dispensing medications, counseling patients, and educating both prison staff and inmates. At some prisons, pharmacists are able to enter into collaborative practice agreements with physicians, giving pharmacists the opportunity to monitor and manage disease states. Another responsibility of the pharmacist is to offer advice on how to control and supply certain high-risk medications to prisoners to help lower the antipsychotic abuse rate. Pharmacists are vital in prisons because a person's ability to receive health care does not stop just because they were convicted of a crime. Prisoners need to be offered their medications in an amount that allows them to stay healthy. Overall, pharmacists can have a big impact on the mental health illnesses seen in prisons. Pharmacists could help providers, such as prison psychiatrists, determine therapy options for patients. Abuse of medications limits the antipsychotic therapy because generally only first-generation antipsychotics are used to treat patients. A future role of the pharmacist could include finding creative solutions to treating mental illnesses despite the antipsychotic abuse. Since pharmacists' roles inside prisons include monitoring disease states, pharmacists could be utilized to monitor a patient's mental health status. Pharmacists could also help with the mental health screening of prisoners, establish a pharmacist-patient relationship, and then treat the patient with appropriate monitoring and dosages of medications. Mental health is an important aspect of everyday functioning, and if not treated accordingly, can cause some devastating outcomes. Expanding the roles of the pharmacist inside prison walls is extremely beneficial as they can improve patient quality of life. This would be possible if they could manage mental health illnesses, help with mental health screenings, and lower the antipsychotic abuse rate. Reform can be achieved by implementing mental health programs both inside prison walls and establishing mental health facilities in the surrounding community. Overall, if reform is achieved, the reincarceration rate of inmates would theoretically decrease and the mental stability of people everywhere would increase. For further information, please consult our paper's references for which this material was analyzed from.